I'm Dr. Deepak Kapoor. I'm president of Advanced Urology Centers of New York, the largest urology group practice in the United States. And I'm also president of the Large Urology Group Practice Association, representing about a third of private practice urologists in the United States. The most common symptom of prostate cancer is no symptoms. By the time you become symptomatic from prostate cancer, it means that the disease has advanced to the point where local therapy and cure is no longer possible. The symptoms that people think about that are associated with prostate disease, which are frequency, urgency, weak stream, waking up at night, those sorts of things, those things are actually more typically associated with a benign enlargement of the prostate. Prostate cancer most usually shows no symptoms at all. If you don't prospectively look for prostate cancer, you generally don't find it. And I think it's important for people to understand that there are other things that cause PSA elevations. The most common cause of PSA elevation is not prostate cancer. It's a benign enlargement of the prostate. As the prostate grows, which happens to men typically as they pass age 50 to 55, as the prostate enlarges, it produces more PSA. It's a volume-related process, which is why we don't rely on just an isolated PSA. We rely on PSA changes over the course of time, as well as certain other parameters of PSA. PSA is a tool that is to be interpreted based on the skill of the person that's interpreting it. So, furthermore, there are many other diseases in the prostate. And the fact that you have one prostate ailment, like BPH, which is benign prostatic hyperplasia, that doesn't mean you're going to get prostate cancer. Prostate cancer and other diseases, the best way to think about it is think about different trees that grow in the same orchard. So you may have a lemon tree and you may have an orange tree. And yeah, they're both trees and they're both growing in the same grove, but lemons and oranges aren't the same. And no matter what, they're not going to become each other. So prostate cancer and BPH are completely separate disease entities, and they shouldn't be confused. Now, that doesn't mean that we can't treat BPH. There's lots of treatment options that are available to that, but probably that's a topic for another discussion. The enlargement of the prostate, and again, this may be a little bit more esoteric for the viewers than we need, but the majority of benign prostate growth occurs in what we call the transition zone of the prostate. And most of the prostate cancers occur in the posterior zone of the prostate. So when we feel, it sort of is an interesting thing, because most of the benign growth of the prostate occurs in an area that we can't feel. The benign growth actually grows internally in toward the bladder and the urethra. But most of the malignant prostates grow in the posterior zone, which is the area that we feel with a rectal exam. That's why we do the rectal exam.